Okay, so let's talk about under eye filler and why I feel it's one of the most overpromised and underdelivered treatments as far as injectables. With med spas popping up on every corner, I think it's very important for you to know the credentials of your injector, especially the injector who's performing under eye filler. What I found in my practice is that for young patients, specifically those under the age of 30 years old, I think under eye filler can be a very good option. Those patients typically have what's known as a tear trough, and that's usually a genetic thing that we see in some patients. Under eye filler can be very useful to help smooth that area and give patients the results that they're looking for. So as we age, the under eye can become a very complicated area. It can be an issue with the skin, it can be an issue with the orbital fat, and it can also be an issue with a loss of volume in the cheek, leading to hollowing underneath the eyes. So at that point, it becomes a surgical problem, and trying to fix a surgical problem with a non-surgical solution can certainly lead to problems. Sometimes we see those problems initially, but a lot of times we see those problems even months and years down the road. What we can see sometimes is that the filler becomes visible, and it can certainly be visible in certain facial expressions. For instance, when a patient smiles, sometimes the filler can lump up and you can see it. It can also sometimes contribute to puffiness or swelling underneath the eye. And most patients who are trying to get under eye filler are trying to look for a reduction in the swelliness or the puffiness under the eyes. So I think for patients who are seeking improvement in the under eye area and want to minimize complications with under eye filler, I think it's always important to see a plastic surgeon. That plastic surgeon can give you honest recommendations on what the best treatment process is for you.